Hey guys, we are back with new TikToks to watch. So this one, my colleague is removing a very deep cavity that is near the neck of the tooth. These cavities are quite dangerous because they can so easily and fast go to the nerve of the tooth and cause a nerve damage. Then you need a root canal treatment. As you can see, the nerve is very close because it's getting exposed. The dentist is cleaning. They're using the slowest drill they can so they don't accidentally end up in the nerve, but it's already too late. So leaving this cavity be is the reason that it got to the nerve in the first place. Now they have cleaned all the surroundings. They're drying it. And now this instrument is called the dental file. They're going inside the canal and cleaning out all the nerve and debris. Now each country has its own regulations. Here in Australia, we have to use a plastic sheet around the teeth that is called a rubber dam to make sure none of these files will drop out and somebody will accidentally swallow them. So the guy is getting a root canal treatment done, and the files are getting bigger and bigger. So you see it's now to the blue color, and each color that changes, it also has a bigger and wider size. The canal inside is having the nerve of the tooth and blood vessels. That's why you feel pain when that's inflamed, because it's taking all the information, bringing it to your brain, telling it, oh my god, it hurts. Then when it's cleaned, they dried it, and now they're putting in a material which is called gutta, and that's the material that we use to fill the canal of the tooth. Now, as I said, the technique might be different in each country, but overall, it's the same thing that we do over here too. Now he's cleaning around a little bit more. I'm not sure why, because all the cleaning is usually done beforehand. And he's using this blue gel. The blue gel is called acid etch. It makes the surface of the enamel a little porous, so the filling will attach to it much better. After it's completely dried, they use the bond. The bond is like a glue. Before we put in the composite or the filling material, polymerize it with blue light, and now the composite or the filling material is going in, shaping it to the shape of the tooth using the blue light so it becomes hardened and polymerized. And that's it. It's just shaping it further and further. If you compare it to what it was at the beginning, it's a fantastic transformation. I probably wouldn't do everything in one go, and I would give the tooth a little bit of time to heal the nerve, heal the bones. Now, I'm not sure, maybe this video is taken in 2 different appointments, but it looks like it's only in one go. And that's all. One very common question from people, do I need antibiotics? Each person is different. If the infection causes any systemic effects like fever, then we definitely give you antibiotics to kind of help getting rid of it from your body. So it's not a good idea to leave that infection behind thinking, oh, it's just a tooth. It can travel to other places and causing systemic effects. Now the dentist is polishing the filling, giving it a shape that other teeth have, making it smooth, making it comfortable for the patient. And after this, the treatment's gonna end. Root canal treatment is not a painful treatment, but you have to keep in mind what hurts is before you come in, because the nerve is so inflamed that you're in pain. So it's best to avoid them. How can you avoid them? Good oral hygiene. Clean your teeth regularly at the dentist or hygienist. Floss your teeth, because that's where food gets stuck and hits your nerve. And see your dentist every 6 months to make sure that we take x-rays, and if there is any problems, we'll let you know before it happens. This is another video of similar situation. The reason for these kind of cavities is so different. Drug abuse can be one of them. A lot of sugary drinks, fizzy drinks, neck of the teeth are all exposed, and that black color is basically just gunks, and the bacteria have eaten through the tooth, left demineralized soft tooth structure. So the dentist is cleaning it. That pink material is just carries disclosing agent, so it shows wherever you left a bit of cavity to go in and clean better. Some places use it, and then the dentist is drilling out all the soft material. Whatever is soft and not hard tooth structure, it's basically ill, it's not clean. They are checking it again, making sure they're not leaving any cavities behind. This is a slow speed burr or a drill where the dentist uses not to remove a lot of tooth structure and go in more carefully. These kind of cavities right in between teeth happen mainly, 98% of the problem comes from not flossing. You don't floss, food gets stuck right between your teeth. The bacteria also enjoys that food, eats it, and creates acid as byproduct. So basically when the bacteria goes to the toilet, they create acids, and that acid rots your teeth. that's when you have these holes right in between your teeth, and the dentist is cleaning them, leaving behind hard tooth structure, making sure that there is no area that's still decayed, and then they fill on top of it. The fillings we use is usually composite. Composite fillings are made of polymer or plastic. Their average life is about 5 years. This second cavity you can see here, that's a very large cavity. I would say there's a very good chance that it will reach the nerve of the tooth. And over here, patient is missing a tooth and the dentist has made them a resin bridge. So this bridge is a fake tooth hanging in between two other teeth, making it look like they have teeth, but they're actually missing a second tooth. Resin bridge is basically kind of made of composite, almost the same thing, and it's not as durable as porcelain bridge, but they are more cost efficient and they would last a while until you have to change them again. If you want something that lasts you longer, you have to go with a more durable material. I can see here that they are continuing the treatment by kind of a smile makeover. So they are adding composite on other teeth and doing something that's called a composite bonding or composite veneer, making them a little bit taller or bigger, closing the gaps, and the edges were a little broken, so they're trying to get a better shape. Watching composite bonding is quite satisfying. Now, as I said, composite lasts you about, on average, 5 years. I've seen much longer if you take good care of it, and it all depends on your bite, how you close your mouth. That's why we usually recommend get an assessment before you go ahead with any of these treatments. Because if your bite is edge to edge, if you're already biting on each other, the composite's not gonna withstand. The dentists have cleaned and polished everything, and you can see how shiny and nice it looks. Unfortunately, composite can get a lot of stains over the years, and it has to be changed. Thank you so much for watching. If you like this video, subscribe below, and I'll see you at the next one.